Hello, everyone. Welcome back to Understanding Iron Deficiency. This is a complete guide, and today we're going to be talking about signs and symptoms of iron deficiency. So, today we're talking about these signs and symptoms, and we're only going to discuss them a little bit. And pretty much every single one of these signs or symptoms we'll do a later video on that will go more in depth. This is just a uh, general way so that we can kind of form a picture and a general understanding of iron deficiency, what the symptoms are like, how they can manifest, right? So we're talking about pallor, fatigue, irritability and sleep issues, cognitive issues, anxiety, depression, and derealization, frequent infections, bruising, cold hands and feet, sexual dysfunction, poor appetite, nausea, hair and nail issues. We're talking about all those things in this video pretty quickly, and then each one of those topics will get their own video later on in the series. First off, we have pallor. And pallor, you might have heard this word before, it might not. It just means to have pale, sickly, anemic looking skin. All right. So the main thing here with pallor is that you are lacking a rosy glow, right? And that rosy glow, it comes from your blood supply, right? Your blood flow to the skin. A pallor is different from a paleness that comes from a lack of sunshine, right? You can be pale because you just never get any sunshine and your body doesn't produce melanin, but this is different. This is a different type of paleness, let's say. Right? Pallor can be visible regardless of racial skin tone, right? It might be easier to identify on certain racial skin tones, but when you are familiar with it and when you have trained yourself to see it, it's obvious no matter what racial skin tone somebody has. If you've ever heard somebody say or said yourself, you look white as a sheet, or you look pale as a ghost, and then they might ask, like, is everything all right? Like, are you sick? Are you coming down with something? People ask this, and they ask it suspecting that somebody might be ill because this happens when you get sick. When you get sick, your body goes into a sort of functional iron deficiency, which we'll talk all about later. But you basically become temporarily, at least, iron deficient when you come down with a cold or an infection. And you even though you don't normally look this way, you might start to look pale when you're sick, right? And a lot of the other signs and symptoms of when or the other problems when you come down with an infection, such as fatigue, right? Your hair doesn't feel as good as it usually does. You might lose your appetite, right? A lot of these signs and symptoms are also related to iron deficiency. Um, and yeah, so the rosy glow, the redness, it comes from our red blood cells, and it's hemoglobin that gives it that red color, that gives our red blood cells that red color. And when the blood is oxygenated with oxygen-rich hemoglobin, uh, your skin is more rosy. It has a more of a rosy glow to it, right? And you can also kind of see uh, this oxygenation and the hemoglobin and how oxygen interacts with it. If you look at like a piece of beef, for example, it might be bright red at first, but then as it loses oxygen just to the atmosphere, as it sits in your fridge, it gets darker and darker. And so it loses its bright red glow, right? Because it's not oxygenated. Uh, the easiest places to detect and notice if somebody has pallor or if somebody might be anemic or iron deficient is on the face, palms, nails, and the inside of the eyelid. So here are some pictures for it. So we can see here just a pale face, right? She kind of looks sickly. Here we see a nice before and after. You can just see the difference, right? She looks so much better in this picture. She looks a lot healthier. This one, it's clearly just a Photoshop because it's the same face, but they do a good job of showing the difference. Um, let's see. Here on the palms, right? You can see a huge difference between these two palms. This palm has nice blood flow to it. This palm does not. You can also notice, oh, I didn't know I was recording there. Let's see. Okay, can't change that. You can also notice on the tongue, you might see that the tongue can be more pale, right? Any spot where blood flow is coming close to the surface. This picture is actually just a picture of a woman who's going through an iron transfusion. So this is before, during, and after the iron transfusion, and you can see the immediate difference. Here you can see bags under the eyes. That's another sign of iron deficiency. It's not, it's not quite the same as pallor, but that's another visible sign that I thought I'd put in here. And also the nail beds. The nail beds are a good spot, right? A nail bed, you should see them be pink, especially if you push against it. And actually, in these pictures, you can see the nail beds too. Here we see a really light pink, and then here we see better blood flow right here. The last spot I'll point out, this is a quick and easy test. You just pull down your eyelids and you can see the blood flow, right? You can see that bright redness. And then here, this is some pretty bad pallor right here, right? There's just no color to it, not a lot of oxygen-rich blood flow to there. Okay. Our second symptom that we'll talk about today, just to introduce, is fatigue. So this basically stems from a lack of oxygen, energy, and neurotransmitters, right? You need iron for hemoglobin and you need iron for myoglobin. Both are important for oxygenating all the tissues in your body, myoglobin specifically for your muscles. So if your muscles are really fatigued, if you walk up a flight of stairs and you're immediately fatigued, right? This might be part of the problem. It might be an iron deficiency. It can cause weakness, uh, also shortness of breath because your blood is not oxygenated. So you, even though you're breathing, you just feel short of breath. It can cause dizziness, right? Because your brain's not getting enough oxygen, lightheadedness, and also derealization, which we're going to talk a whole lot more about after. A lot of people don't know what that is, but that's okay. Irritability, kind of similar to fatigue. It stems from a lack of oxygen and a lack of energy, right? When you don't have enough energy, you don't want to, you're less willing to put up with things. Everybody has experienced this before. Maybe you don't sleep well, right? Uh, Iron deficiency can also be related to this through poor sleep, right? Because when you're iron deficient, you don't sleep as well, and also the altered neurotransmitter levels, right? Uh, Iron deficiency can cause sleep issues. So the thing to note here is that your body isn't going to sleep well when it feels that it's suffocating. Okay, so if you're not getting enough oxygen, your body doesn't get to that point of relaxation where it can comfortably sleep. And the other important thing here to know is that in order to sleep, what you're doing is you're recovering, right? You're getting your tissues what they need. And if you're not getting your tissues oxygen, then you're not going to recover well. So a lot of people with iron deficiency, they might be exhausted all day long and then they try and sleep and they can't fall asleep or they don't sleep well. They wake up multiple times throughout the night. A lot of people with iron deficiency, they might even sleep for 10 hours, but then they wake up and they're still exhausted because they're not getting the oxygen that they need, right? This will be fleshed out much more later. Cognitive issues. This is another sign and symptom of iron deficiency. Obviously, these can be caused by other things, but you would be surprised how often it's caused by simple iron deficiency, right? The brain needs a lot of oxygen. It is only 2% of our body mass, yet it takes up 20% of our oxygen supply. Okay? Uh, Also, right, with your brain not getting enough oxygen, you will have attention difficulties, very common today, low motivation, poor memory, right? Anxiety, depression, and derealization, other signs and symptoms and problems associated with iron deficiency. Okay, so we're going to flesh this out much more later, but to note with anxiety, right, you can think of this as your body constantly getting signals that things are bad, things are bad, things are bad. Okay. And if you're constantly getting signals, if your body is weak and vulnerable, right, it pays to be anxious. So you can think of this, it's a lot of these things are adaptive. Your body is doing its best without you're not giving it what it needs, and your body is doing its best, right? Depression, basically, this is just a systemic lack of energy in most cases. You can absolutely be depressed because you have poor relationships and you don't have a good purpose in life and all of this, right? But when it's not because of that, right? It's a systemic lack of energy. It's physiological. Derealization basically just happens because of hyperventilation, and it alters your perception because your brain isn't getting enough oxygen. There's a narrowing of focus. And there are other psychiatric disorders, such as schizophrenia, that are associated with iron deficiency. Much more on mental health later. I love talking about how nutrition affects mental health. People rarely realize how important your physiology and your physical health is for mental health, and we're gonna be talking all about this. Infections and the immune system. Okay, so iron is really important for the immune system for producing white blood cells and other immune cells. So when you're not iron, when you don't have enough iron, you're going to get frequent infections. You might have more difficulty recovering from infections. It's very important for the immune system, as I said. And yeah, much more on this topic later. Bruising. So why does bruising happen? Bruising happens when your blood vessels break upon a hard impact or a trauma, and basically blood spills out into the plasma, into the surrounding tissues, and you can see it close to the skin. And your blood vessels are basically going to break more easily when you're not producing collagen properly or enough of it, right? Your blood vessels are made up of collagen. It helps keep the integrity of your blood vessels, and iron is needed for proper collagen synthesis. Okay. So iron deficiency is not typically or bruising is not typically listed as a symptom of iron deficiency, and I don't like this because uh, iron deficiency is definitely the most common cause of bruising. The reason why they don't list it is that because it can be caused by other things. So it can be caused by not enough vitamin C, copper, not enough protein, like amino acids needed to form collagen. So other nutritional deficiencies can cause bruising, that's for sure, but it's typically because of iron deficiency. Iron deficiency, again, I'm going to rant here. Iron deficiency is incredibly normalized. It is ridiculous how normal people view it as to bruise, right? I've asked people, like, why do you have, you've got a bunch of bruises on your legs? And they'll go, oh, yeah, I play soccer. And so, you get hit by a ball. And I'm thinking in my head, I'm like, you don't realize, like, you should not bruise just because you get hit with a soccer ball, right? Like that is not normal. Your body is showing that it is not getting something that it desperately needs. Some people will bruise even if they're clumsy and they bump into a table, and it's incredibly normalized. And we need to realize that our bodies, we can look at them for the signs and symptoms, and we can read our bodies to see if we are healthy and if we're getting what we need, right? So there's a total lack of awareness on this, and I just wanted to point that out. But cold hands and feet, this is a very common one. And I hope I'm not generalizing here, but I find this much more common in women. Uh, you know, saying that they're cold and they just always feel cold and they can't warm up and their hands and feet are cold. And that is most likely because iron deficiency is much more common in females. Uh, it basically has to do with peripheral blood supply, right? If your body is lacking oxygen, it diverts its blood to the core, to the internal organs that need the oxygen the most, right? And so, along with the cold hands and cold feet, you'll also get dry lips, dry eyes. Your digestive system is part of your peripheral blood supply, so it won't get as much blood and oxygen, and it will suffer. Your reproductive organs are, they're not essential, right? So they're not essential to survival, and so they will get less blood flow, right? So that is all related. And just like we just kind of talked about, sexual dysfunction, right? So iron deficiency is a cause of sexual dysfunction in females, at least. It is almost certainly also a cause in males too, but just not. It's not as important and it's not as common, right? So if it might cause difficulty or inability to orgasm, it might cause a poor sex drive and libido, low arousal, poor lubrication, and it might cause increased pain. And this all stems from a lack of blood flow and oxygen delivery to the reproductive organs that need it. They need a lot of oxygen to do what they need to do, right? Um, so we're going to cover this more later, but this is just an introduction, all the signs and symptoms. Poor appetite and nausea, right? If you're experiencing poor appetite, you might be hungry, but you don't want to eat, right? You just don't feel like eating even though you're hungry. If you're iron deficient, you might eat, but then you have trouble digesting food, and so you don't feel good, and you feel nauseous. These are all very common for people who are iron deficient, right? And look at that, we've gone through it. These are some other symptoms that I don't plan on covering in depth. If you really want me to, you can comment and I'll cover them. But some other symptoms I didn't get to: restless leg syndrome, pica, which is basically eating things or craving things like dirt and ice and wood chips. It sounds very strange, but it's not a very common symptom of iron deficiency, but it does happen. Glossitis, which is just a swollen tongue. Angular colitis or cheilitis, I'm not sure, which is mouth sores and cracks on the corners of the mouth. Dysphagia, which is just trouble swallowing, right? Tinnitus can also be caused by iron deficiency, which is a ringing in the ears. But all of these signs and symptoms, they're not as common, so I don't plan on covering them. But again, comment if you really want me to. Up next, we have causes and risk factors of iron deficiency. So you can take a look at those causes and risk factors. And this was a longer video, like I said, but in the future, they're going to be much shorter, closer to 5 minutes. But yeah, so if you enjoyed this video, thank you so much. I would really like it if you would comment how many signs and symptoms of iron deficiency you might have. If you feel comfortable, feel free to list those signs and symptoms. But yeah, I'd be curious to know how many people have 1, 2, 3, 4, 5, 6, all of these signs of iron deficiency. And also comment if you were today years old when you learned that these signs and symptoms. Maybe you're sitting here like, oh my God, I've struggled with this for years and I didn't know that it was iron deficiency. So if that's you, comment that as well. I'd be interested to know. Thank you so much for watching, and we'll see you in the next video.